As a child growing up, each time we go to the doctor, vaccine or shot are some of the main things we bear as kids. The doctor isn't a fun place as a kid, but also for some adults too. Shots are one of the highest fears of children. The first needle, according to Science Museum, was made by Alexander Wood, a Scottish doctor in the 1800s. That's him. And he first made the needle all metal, so they couldn't, which made it really difficult to see the injection in before and after. So at the time they weren't disposable, so they had to sterilize each needle before and after each use, and which in this day is kind of gross and disgusting to think about. And then in 1956 was when the first disposable needle was made, making it easier on healthcare workers. I believe I am credible in this area because I have went through courses in nursing school on proper ways to give a shot. Since we all had shots many times in the past, I believe that is important for those to understand the process. Shots are one of the scariest parts of the doctor's office. I would like to show everyone the process of giving a shot, but also other various forms of needles and where they are given. So, the 3 different forms of injections I will explain. The first is a subcutaneous injection, mainly used with insulin and is given mainly in the stomach or in the back of your armpit, and then this one it's given in the stomach. The second type is intramuscular, or also known as the IM injection. This is to give injections deep in the muscle. It's given in the ventrogluteal, deltoid vastus lateralis, or dorsal gluteal areas. A Z-track method is used in this case. The last form is the intradermal injection, mainly used to give TB tests or the Mantoux test to check for tuberculosis. This needle is inserted in just the dermis of your skin, and it'll form a bubble, as shown here. The main location is the forearm. So now that you have learned 3 different forms of injections, I'm going to teach you how to give an IM injection in the deltoid muscle according to Berman and Schneider. The first step is to check for allergies, especially the latex allergy, and wash your hands. And then you will gather all your equipment, which would be the pre-filled syringe, alcohol swabs, and clean gloves. You must check the medication 3 times before giving it, just to verify that you have the right medication, obviously, and make sure that all your equipment is laid out. You will then wash your hands again, and since this is an aseptic technique, you don't need to use fully sterilized gloves, just normal latex gloves. You can then apply the gloves and prepare the client. In this case, we are using the deltoid muscle, which is right here, and you will then clean the site with an alcohol swab, which you see here, for 30 seconds and let it air dry. Do not blow on it or wave air at it to try and dry it, because that's just infecting the area again. You'll just have to start all over again. So now you must remove the needle cover on the needle and provide a Z-track method where you use the underside of your hand to pull the skin tight. So you hold it right here. And then you will pierce the skin at a 90-degree angle right here. And you have to aspirate it, which means you'll pull back to see if you get any blood back. And if you get blood return, that means you're in a blood vessel, and you will have to discard the needle and start the whole process over again because you don't want to inject into a blood vessel. You then will inject the medication slowly and count to 10 after it's injected before you remove the needle. And once you remove the needle, then you can let go of the skin and apply slight pressure to it, like a Band-Aid or a cotton ball. So once you get done with this, you will put the safety cover back on the needle and discard in the biohazard box as seen here. You should never throw needles away in the garbage because it just is, if it was to poke someone else, it could be very dangerous. And then you must throw gloves away and perform hand hygiene again, and your gloves have to go in the biohazard box also. So now that you have learned 3 different forms of injections and how to give an IM injection in the deltoid muscle, hopefully this gave you a better understanding of the forms, locations of 3 injections, the process of an IM injection, and remember, shots are only as scary as we make them out to be.